please still get your vaccines. So the SOAP data, which came out saying that the antibody response might not be good in people with blood cancer, that was on 50 people with blood cancer. To give you an example, there's 477 people currently watching on Facebook. You all probably have different diagnoses. You're probably on different treatment. You're probably on at completely different stages. And you probably will have different vaccine responses. And that's what we're trying to find out from this research. The study a couple of weeks ago was incredibly small. It took data from, for example, one person with lymphoma, one person with leukemia, and tried to compare them. And you can't really compare apples to pears. And whilst it's good initial data, it doesn't give us kind of really strong answers. So please still go and get your vaccines. It's really important. Because, we just don't know yet. We just don't know how well people with blood cancer are protected, but we are trying to find out. And everyone in this call is, I'm sure, supportive of that.
We also don't really know yet. I think it's fair to say, and that Peter do disagree with me, but that we don't really know what the actual numbers mean. So how big the number, how big the concentration of antibody needs to be, because actually the proof of the pudding, whether the vaccine has worked, is not what the level of antibody you get in your blood. It's actually the fact that you don't get infected with COVID, or if you do, you get a runny nose and it goes away, or a dry cough, but you don't get a chest infection and you don't end up in hospital and you don't die of it. So, stopping you getting ill and stopping you getting an infection is actually kind of the what we're trying to achieve with the vaccine. It's not, the measuring the antibody response is what us doctors and scientists do, because we think it's a marker of how effective the immune system is, but the real marker is whether you get infections or not.
I think that's a really important point. There's a kind of magic to numbers, isn't there? And certainly people who've been through treatment for blood cancer will know you spend a lot of time thinking about how many platelets you have or how many white blood cells you have, and we kind of fixate on numbers. But it's absolutely true that we don't know whether this level of antibodies is makes you safer, or this number of T cells. And I think what we can be absolutely certain of is if you don't have the vaccine, it certainly can't work. And we know that particularly younger people are still a bit reluctant and a bit wary of having the vaccine. And I realize that people like me with grey hair sitting here saying, get vaccinated, I've had my vaccine, I think it's great, is not very influential, but it is so important for everybody to get vaccinated. It won't work if you don't have it. There's a reasonable chance it'll work if you do. And the more people have it, the safer we all are. And having lots of people around you who are immune is a very good bit of security, even if your own immune system isn't great. Having lots of people around you whose immune system is not stopping the virus being carried is terribly important.
Even though I know that it's not necessarily going to give you the same level of protection as other people, I don't know that for sure. But I feel that, coming back to Emma's comment, it's kind of like going to be that tipping point that maybe keeps me out of hospital. Maybe keeps me, if I get into hospital, maybe keeps me from going into a intensive care unit. So I think whatever protection we get is a bonus. So it's just really important that blood cancer patients get their vaccine, and it's vitally important that we have a chat with anyone we know that is a bit reluctant and have a really good chat about getting them vaccinated as well.
Absolutely. That's a really good point, Gill. And, we've talked about for a long time blood cancer patients having some protection, and this kind of notion of some protection is really confusing, but it does essentially mean, it might be that if you do come into contact with COVID, instead of being in hospital, you have mild disease and you're in bed for a couple of days. So, it's really important to get the vaccine to kind of try and benefit from any protection you might get. And just to kind of close this bit of the conversation up a little bit, I just want to reiterate that we are speaking to the JCVI both about letting clinicians exercise their clinical judgment on the dosaging, and we will keep you updated on that. And we are also talking to them about vaccinating household members. So please, if you're not already in contact with Blood Cancer UK, please kind of follow us on our social medias and sign up for our e-newsletter. And if anything changes, we will of course let you know as we get the news.